So the people I work with in patient safety draw a real distinction between investigating why an error happened and not including blame in that, and then learning from it. So they draw a real distinction between that and what they call poor performers. Managing poor performance is completely separate and should be from error investigation. So at first, when we were talking about non-blame environments, non-blame cultures, we're talking about error investigation. When something goes wrong, what should be your approach to finding out exactly what happened, what contributed, and then learning about what needs to be done so it doesn't happen again. It was never about letting poor performers off the hook from performing the way they should, okay? And so we can't get to non-blame and error investigation until we give up linear thinking and thinking that it's just simple and that it's just all about blaming or taking care of one person involved and then being done with it. Everybody who talks about patient safety or who works in a healthcare environment knows somebody who was involved in a medical error and has been a stellar performer. Excellent nurse, excellent physician, excellent pharmacist, but things aligned and something went wrong, and despite them making a decision they thought was the best at the time, it wasn't the right one. It turned out not to be the right one. So right there begs the question about poor performance and error. I mean, things will go wrong despite the competencies of the people that you have around. So I think that's another area I think that leadership has to get a handle on. When I was a manager and we had poor performers, you know, you could kind of do a little wrist slapping, and you could try, if it was really a poor performer, just to get rid of them. But most often, because of staffing and other issues, you kind of slap their wrist or hope next time they do better. And it was difficult and time-consuming to manage poor performance. The thing was, when I was a manager in the 70s and 80s, our patients aren't like they are now. So people could cover for those people, or you could pick up after those people, or you could. Now, as we know, teamwork is so important in the acuity of our patients and what goes on in a busy, hectic, acute care setting. And I find in our research it doesn't matter what setting it is. If it's healthcare, it's complex and it's busy. Teamwork is so important. You have a poor performer, you're in trouble, because everybody needs to rely on everybody else for something and needs to know they can count on somebody else if they get into a situation. So you could have a poor performer who is involved right at the point of an error, or you could have a poor performer who isn't involved at the point of the error, but one of the contributors to the error happening is the fact that somebody didn't feel like they could rely on and call that person for help because it wouldn't have been good enough. And so they end up doing the best they can, and they're then involved in the error. See what I mean? So poor performers are huge, and I think we need to re-look at helping first line people directly at the point of care who manage, giving them the support and the education around managing poor performers. Because poor performers, now to me, it's clear it should be easy. They either do need some education that immediately solves the problem. They need to be rerouted into a whole different role, or they don't need to be in healthcare. Those are the three things, and we need to do it quickly once they're spotted, because we can't afford to have them working in a situation. Someone said to a colleague of mine, "Isn't there ever a time when we can blame somebody?" These are one of the people that just wants to make it real simple and linear. Okay, isn't there ever a time when we can blame somebody? And the colleague of mine said, you know, even if you have a poor performer in the situation at the end of the thing, and you know, people are looking around going, oh, you know, that was just an accident waiting to happen. Not surprised there. That person apparently was a known poor performer. So it was a systems issue. How did a poor performer end up in a care situation? And apparently had continued because people knew that it could have happened. So, you know, there's always systems issues involved.